According to the National Institute of Mental Health, eating disorders are serious and often fatal illnesses that cause severe disturbances to a person's eating behaviors. Common eating disorders include anorexia nervosa, bulimia nervosa, and binge eating. People with anorexia nervosa suffer from body dysmorphia, wherein they see themselves as being overweight, even if they were very underweight. They tend to weigh themselves constantly, keep tabs on the amount of food they eat, keeping it to a minimum. According to the National Institute of Mental Health, anorexia nervosa has the highest mortality rate of any mental disorder. People that suffer with bulimia have large amounts of food intake in one sitting, or otherwise called binge eating. Then they purge, use laxatives, exercise excessively, fasting, or anything to overcompensate for having eaten so much. People with bulimia are not typically underweight and maintain a consistent weight, however, have other health complications, such as damage to their throat from the constant purging. There is evidence that bulimia and anorexia are more prevalent in some societies, particularly those with Western cultural influences, than in others. Prevalence rates in Western countries for anorexia nervosa range from 0.1% to 5.7% in female subjects. Prevalence rates for bulimia nervosa range from 0% to 2.1% in males and from 0.3% to 7.3% in female subjects in Western cultures. There is a striking absence of documented cases in much of the world, particularly in Africa and in the Indian subcontinent, and the few documented cases of bulimia that emerge in other regions of the world, such as in the Middle East and in Southeast and East Asia, appear to be in places where there is more Western influence. The prevalence of eating disorders in non-Western countries is lower than that of Western countries, but appears to be increasing. Treatment of eating disorders generally addresses the following factors. They correct life-threatening medical and psychiatric symptoms, interrupt eating disorder behaviors such as food restriction, binge eating, etc., establish normalized eating and nutritional rehabilitation, challenge unhelpful and unhealthy eating disorder behaviors and thoughts, address ongoing medical and mental health issues, and also establish a plan to prevent relapse. I am Ana Maria Peñalosa at Florida International University. Thank you for listening.